statewide mask mandate has expired. So have the coronavirus orders. More than 46% of Ohioans have received at least one dose of COVID vaccines, and more than 41% are fully vaccinated. Things seem to be getting back to normal. But there's one thing to remember. The virus continues to pose a threat to people who haven't been vaccinated, and in some very rare cases, to people who are. For the past 6 months, Ohioans have been getting vaccinated against COVID-19, and it's made a difference. The COVID death rate has dropped from 141 on November 25th to single digits these days. And while many Ohioans are no longer wearing masks, the threat of the virus is still real. Beth Mulcahy of Wooster knows that. She got her second COVID vaccine on April 9th. When her son came down with COVID 20 days later, she took care of him, thinking she was more than 2 weeks past her second vaccine and would be safe.
About a week after my son became ill, I got sick and was tested. I was very surprised to be COVID positive after being fully vaccinated. And I have been very sick, and it has been very difficult. It's been difficult for me to work, to take care of my kids, and to sleep.
When fully vaccinated people get COVID, it's called breakthrough COVID. As of June 2nd, Ohio recorded 95 cases of breakthrough COVID that required hospitalization and 14 deaths. But that's a very small number when you consider the total number of Ohioans vaccinated, with 4,495,492 Ohioans having their second vaccine by May 19th, 2 weeks prior to June 2nd. That means approximately 0.002% of fully vaccinated Ohioans were hospitalized, and less than 0.0003% died.
Vaccines, while very, very good, have never been and will never be 100%. There are a lot of factors involved with the response to a vaccine, including your own immune system's response. So my particular caution would be to those who might have conditions that have affected their immune systems, and they need to be particularly careful.
The CDC said this week that a study of 4,000 people who got the 2-shot Pfizer and Moderna mRNA shots found full vaccination with 2 doses was 91% effective at preventing COVID infection. A single dose was 81% effective. The single-shot Johnson & Johnson vaccine's effectiveness is lower, but is still considered extremely effective. Doctors say those with immune system problems and those who are unvaccinated should beware, especially right now when highly contagious variants pose a threat. Dr. Patty Manning Courtney with Cincinnati Children's Hospital says there are children right now who are quite sick with COVID. And since kids 11 and under cannot be vaccinated, she says they should still wear masks, just as before.
When they're out in crowds, out in public, out in stores, out at events, they should be masked, and we're of the belief that parents should mask and family members should mask along with them. It's just the only way to protect that population.
If vaccinated people get COVID, medical professionals say it will likely be less aggressive than those who have had no vaccine. But for those who get COVID without having the protection of a vaccine, the virus can be very dangerous.
So I got sick in March of 2020. I was mildly ill. I wasn't hospitalized. I came close once, but I wasn't hospitalized. And I seemed to get better. And then I started having some other problems.
For more than a year now, she's suffered with a variety of problems, including fever and fatigue.
Here I wear this band that constantly measures my heart rate, my respiration, all of these things. And so it tells me when I've done too much. So if anybody knows anything about dysautonomia, you just have a certain amount of energy every day. And once it's done, it's done. And so I use this technique called pacing. And, it means sometimes I decide if I'm going to cook dinner or do the dishes, or if I'm going to do laundry or fold it.
Doctors say they want to prevent people from getting seriously ill or dying from COVID, and the best way they say to do that is to get vaccinated. Death totals, case numbers, and hospitalizations are way down, as more than 5.3 million Ohioans have received at least partial vaccines at this point. But doctors say that rate needs to climb significantly before herd immunity could possibly be achieved.